My name is Dr. Kelly Betts. I'm out of Baltimore, Maryland, and I have been in dentistry for over 20 years, but I've been practicing as a comprehensive general dentist for the last 8 years. I began my journey with Pathways back around 2020 with some resident friends of mine. After we had graduated our residency, we knew that we needed a little extra CE, and it was an excuse to kind of help, see each other again and learn together. So I started with Implant Pathway with the Fast Track course, and it was pretty much the first day of the rest of my life, and I ended up doing sequential courses throughout the next 5 years or so, and was really fortunate to be asked to become a mentor in the programs as well. So in dentistry, it's really easy to take things a little too seriously. So I've always been a really happy-go-lucky person. It's, even in childhood, my parents always said I was fairly happy-go-lucky. So I really enjoyed when I was started in dentistry, even when I was starting as an admin team member, right outside of high school. I really loved making patients feel comfortable. And, it just seemed really natural that if you were at a place where you were helping build people's smiles and helping them smile, that you would do that kind of from the inside out, so that you would bring joy, as you're helping them restore their smiles. So we joke a lot. We try to keep things really light and airy and fun. And I have a really impeccable team that, they've all had histories themselves of having some level of dental anxiety. So it's really, really nice to be surrounded by people that really just help lighten up the mood and make people feel comfortable. I knew I wanted to go to dental school. I knew that it would be a little bit of a uphill challenge, as it always is, but I wanted to really hit the ground running and learn a little bit more. I had been shadowing in physicians' offices and things like that, but not a lot with dental. So I had the opportunity to work at the front desk at the Ohio State University Dental College. So when I was applying to their dental hygiene school and kind of getting into assisting and sterilization and all of that, I worked as a front desk team member there, which was really cool. I wanted to help people, which I think a lot of doctors of any discipline want to do. I wanted to care for people, but I also really loved, my dad's an architect, and most of my family are engineers, or some things where you use your creativity, you learn to design, you build things, you create things. So there was always that kind of artistry and science behind what I wanted to do. And so when I really got introduced to the field of dentistry, it was like a natural fit. When I think about like hosting Thanksgiving dinner, you have the outcome in mind, right? So you have what your ideal result would be, and that would be making sure that like everyone's comfortable, everyone's fed, everything looks good. So there's a functional component to it, there's an aesthetics component to it, and it does require planning with keeping the end in mind. So much like you're planning a Thanksgiving meal, you have to, know exactly where you're going. You have to know where to get your food, how much to get, all that preparatory stuff. And then the timing is really important too. So there's the timing and presentation. And so it's really fun, whether it's cooking or, like you said, planning a stage play or something. You always have the end result in mind, and that's making the person on the receiving end happy with the result, and knowing that you created that. So it's really cool those are really great analogies, and I love that. So yeah, planning really well, having the end result in mind, timing and execution, and making it really enjoyable and memorable for everyone involved.